Hello, how are you? Dr. Chudi Ufondu of Snowspirations Global Health Solutions. Thank you and welcome to our weekend open clinic. Today's topic is very important to all our members who are believing God for babies. So if you're currently going through struggles, if you're encountering challenges, you need to be here right now. So when you join, introduce yourself, tell me where you're located, then I'm going to start. We are talking about fertility test. Why do we need to request some fertility tests, both for the females and the males? What are the functions of those fertility tests? How can those fertility tests help us in helping you to achieve pregnancy? This will be my topic this afternoon. Immediately after this topic, I'm also going to repeat this clinic in Facebook. So if you're in our Facebook, please join us. But let's get started. You see, this is the female reproductive system. And a good understanding of the female reproductive system will help us to understand where you might likely be having delays. So if for some reasons you've been with your partner, you're 35 years and above, you guys have been making love regularly without protection, and after 6 months, pregnancy didn't happen. And you begin to worry, you begin to freak out. Oh, what's going on? What will happen? The very first thing we need to understand is the female reproductive system. So the fertility tests are very important in understanding where the likely problems will be. And I'm going to list the important fertility tests every woman must conduct, and the report has to be within the last 6 months. So the very first line of management for both female and male infertility is to run fertility investigations. Number one, your hormonal assay, your hormonal test. We have to check the level of all the important reproductive hormones. I'm going to list them. Progesterone. Progesterone is the pregnancy maintaining hormone. For you to sustain your pregnancy, we have to have adequate level of progesterone, which will lead to good thickening at the endometrium. Now we go to estrogen. Estrogen is the female reproductive hormone. It's the hormone that actually confers on you that femininity. Your estrogen level must be within normal range. Follicular stimulating hormone. Your follicular stimulating hormone is a very important hormone, part of the hormones we call the gonadotropins. They are actually produced in a special place in the brain. Your follicular stimulating hormone is the hormone that will go and start priming your follicles, developing the follicles. Then at the end of the month, one follicle will become dominant. That dominant follicle will contain the egg you will release during your ovulation. Luteinizing hormone. Your luteinizing hormone is also very important because it's the hormone that indicates, it's the hormone that signals to the body that the egg is about to be released. So if you have ever checked your ovulation through ovulation test kit, what you're actually checking for is the LH hormone, the luteinizing hormone. Before ovulation happens, you will have a sharp increase in your LH hormone. It's called LH surge. This happens before you eventually ovulate. Your prolactin. Prolactin is a very important hormone that predisposes you to the ability to breastfeed your baby. Very, very important. Your prolactin level must be within normal range. If your prolactin level is high, it will affect the possibility of you to ovulate, and we need to bring it within normal range. Your thyroid hormones. Very important hormones that controls pretty much everything in your body. So these are the basic hormones we have to check. If any of them is up or down, they will lead to a condition we call hormonal imbalance. Hormonal imbalance is an isolated reason why you might not be able to become pregnant. We must discover that and we must fix that. Let me give you an example. If your prolactin level is very high, it's called hyperprolactinemia. We must give you some drugs to bring you within normal range so that your body will be able to ovulate. If your estrogen level is very high or low, it will affect your ability to ovulate. If your progesterone level is low, likelihood is that pregnancy will not happen, or if pregnancy happens, you might likely miscarry that pregnancy, or you will have stillbirth. When your follicular stimulating hormone is very high, and your LH hormone is very high, and your estrogen level is very low, you are likely getting ready to enter menopause. This will happen when you enter menopause. Now, among all these hormones I've mentioned, they are not as important as your ovarian reserve hormonal check. When we want to check the quantity of eggs you might likely have remaining, we must run our anti-mullerian hormone test, AMH. Anti-mullerian hormonal test is the most important fertility test for all women, because the outcome of the anti-mullerian hormone test will give us an idea of how we can manage you to get good outcome. Now, when we are done with the hormones, we have to go to your tubes. So we have to check the state of your tubes. How can we do this? We run a special investigation we call HSG, hysterosalpingogram, a special X-ray. We push some fluid through your vagina, goes through the cervix, get to the womb. Then as it's getting through the tubes, we take a couple of pictures to see if your tubes are open. So every woman going through infertility must go for hysterosalpingogram. Very important. Now we have to look inside the womb. Generally, we'll run an ultrasound. That's about the baseline we can run to check the state of your womb. Your womb must be very user-friendly. We have to rule out fibroids, polyps, and a couple of other pathologies inside your womb. Very, very, very important. Now, we also have to check your status regarding chlamydia and gonorrhea, two of the sexually transmitted infections that can affect your ability to become pregnant. These are the baseline fertility tests that all women must go through. There are a couple of other additional tests we might require you to go for. Some women might go for hysteroscopy. Some women might go for other checks to see the nature, laparoscopy. So it depends on the need. But the ones I mentioned are the baseline. Now, have you noticed something about all these investigations? It's not something you can do at home. You have to go to the lab. Remember, today we're looking at the fertility tests you can do at home and the ones you can do in the lab. Unfortunately, you have to get to the lab because all the investigations I mentioned, we have to collect your blood, store your blood properly, then investigate with your blood. So it's a test you have to go to the lab for. Unfortunately, they are expensive. But we have to do what we have to do, because if we have to manage your infertility, we need to know where the problem is coming from. Assuming we notice your two tubes are blocked, then we have to re-strategize and start thinking of IVF. But if we notice that your tubes are still open, and if we notice that you're ovulating, and if we notice that your hormones are good, then we can begin to do things differently. If we run some hormonal checks and we notice you're not ovulating, there are a couple of hormonal tests we can use to confirm if you're ovulating or not. But the most important one is day 21 progesterone. If your day 21 progesterone is giving us a positive feedback that you're ovulating, then we can check out the fact that ovulation is good. We begin to look at other parameters. So your fertility test, it's very important. Now, this is for the females. For the males, we have to importantly look at the seminal fluid analysis. We have to look at the sperm. When we're looking at the sperm, we're looking at three things. We're looking at the counts, we're looking at the morphology, and we're looking at the motility. Of the three parameters in the sperm for the males, we are more interested in the motility. You might have few sperm, you might have few healthy sperm. If they are motile, that means they can swim. They can move from the vagina, pass through the cervix, get to the womb, then begin the journey to the tubes. But we want to have adequate sperm, good-looking sperm. For the sperm to be good-looking, they must have a head, a middle piece, and a tail. So this is for the males. Now, generally, of course, we want to look at your body mass index because we want you to be within the normal BMI. So if you're planning to become pregnant, both for the males and the females, we want your BMI to be within 18.5 to 24.9. We don't want you to exceed any of this. We don't want it to fall below 18.5, and we don't want it to go above 25. We want it to be within 18.5 to to 24.9. This is the healthy range. When you begin to go beyond 25 and it's below 30, you have overweight. When you go above 30, you have obesity. When you go below 18.5, you have underweight. We don't want it to be underweight. We don't want it to be overweight. We don't want it to have obesity because it will also affect your ability to become pregnant. We also check the males. Now, when we've checked all this, we can now begin to look at the diagnosis. Now, remember, you don't take yourself to the lab to run all these investigations. So we've seen so many women that go to the lab, they do the wrong test. Because it's very expensive, we want to be the one that will control the test you will do. So we want to be the one that will tell you to go for your HSG, go for your hormonal assay, go for your ultrasound, then if need be, we can begin to do the other ones. But these are the standard baseline investigation. Now, if you are not able to do all of them, there are standard ones you must go for. We must have your ovarian reserve, especially if you're above 35. We have to know. Because let me give you an example. Assuming your 2 tubes are blocked, and you didn't know that your 2 tubes are blocked, but you're complaining you can't become pregnant. If you complain that you can't become pregnant and the tubes are blocked, will you become pregnant naturally? No. Why? Because the 2 tubes are blocked. Then if we run an HSG and we discover that maybe 1 tube is blocked, the other one is open, well, we can still continue to manage you as someone that can still become pregnant naturally. But if we discover that the 2 tubes are blocked, we will still continue going the natural way. No. Why? Because pregnancy cannot happen if you don't have at least 1 healthy tube. So it's very important. The same thing is applicable to the males. If we discover you have azoospermia, azoospermia means, unfortunately, when we check your semen analysis, we didn't find any sperm. It can be obstructive azoospermia. It can be non-obstructive azoospermia. If we notice that a man doesn't have sperm, what are we going to do? We're going to counsel him, and we're going to encourage him to go for donor sperm. So every investigation we are requiring from you is very important, and we want it to be within the last 6 months. The more current your investigations are, the more current your fertility investigations are, the better we will be in a position to help you. They must be within the last 6 months. A lot of changes can happen in the body of a male and the body of a woman within 6 months. So please, once you have established with a gynecologist and the gynecologist is not able to help you naturally, please allow him refer you to a fertility specialist. By the time you get to the fertility specialist, we have to run your HSG, we have to run your ultrasound, we have to check your hormonal assay, we have to check your profile for chlamydia and gonorrhea. Then when we have all this, then we can begin to look at things differently. Of course, we need to know your blood group, we need to know your genotype. These are additional investigations you can run. And of course, we need the males. So infertility is not about female, it's 50-50. So we need to know all this and we need to factor all this so that we can be in a better position to treat you appropriately. Fertility management is evidence-based management. It's not a blind management. We have to have our facts. We have to have our evidence. So if I say that this lady is having infertility and it's female factor infertility, then I can tell you it's because your tubes are blocked. It's because you have hormonal imbalance. It's because you have fibroid. There are some fibroids that can affect your ability to become pregnant. So we need to know exactly what we're working for. Now, in some situations, we can check everything and everything will be fine, both for the male and the female. If in that situation, we've checked everything, you're okay, you're ovulating, everything is good, your partner has good sperm, but pregnancy is not happening. At that stage, we also have a diagnosis for that. It's called infertility of unknown origin. We need to begin to treat you differently. So baseline, we need to know. Okay, so thank you so much. I'm going to open the clinic now, and I will encourage you to ask your questions. Remember, in less than 24 hours, we have a big event tomorrow. Gender selection and prevention of sickle cell disease masterclass. You do not want to miss this event. If you so love to have your specific gender, this is the event you must be in tomorrow. Make sure you go with your partner. Make sure you send email appropriately. Make sure you have your Zoom set up. Once it's 9 p.m. tomorrow, we are going to start. Now, the clinic is going to open. Feel free and ask your questions. Okay. can see the whole admin is in the clinic, so admin is going to help you. COO, thank you. Chinyere and Onyinye, thank you guys for coming. Please feel free and ask your questions. Ask your questions. Okay? So it looks like we don't have any question about the presentation. Okay. Okay. That's a very important question from COO. So here's the deal. Prior to even planning to becoming parents, you have to go for your preconception check. Preconception check. Very important. So let me give you a time frame. Your partner proposed to you. You guys decided you're going to be family. Before you even begin to make love, book appointment. Go to your gynecologist. Let your gynecologist run your baseline investigation. Blood work, pap smear, everything. Now, when we know your baseline, then you can know the areas you need to work on, including your blood level. There are some women that might be anemic. When we check that box of your baseline well-woman check, then we also encourage the man to go for his own preconception visit. Then both of you can go together to a particular provider. Then we can know your baseline. Now, once you guys start in earnest, there are a couple of things you need to do differently. For the woman, you need to start taking your prenatal multivitamins immediately because you are expected to have adequate stores of these prenatal multivitamins at least 3 months before pregnancy. When this is achieved, then when you begin your ability, when you begin your belief to become parents, it depends on your age. The borderline, the bottom line of everything is to make sure you're making love regularly, you're praying, consistently, and you're doing everything we're teaching you. If you're 35 years and above, we want to give you 6 months. So you and your partner can make love generally, make sure everything is all going good for 6 months. At the expiration of 6 months, if pregnancy is not happening, that's the point you begin to seek for help. If you're below 35, 12 months. At the expiration of the 12th month, if pregnancy is not happening, that's the point you need to begin to go for assessment. We wouldn't want you to just immediately jump into freaking out, wasting resources that you can't become pregnant when you have not tried the natural way. The best way to become pregnant is through the natural way. So you would have checked the box for 12 months and 6 months before you begin to go and waste your resources. I love that question, COO. Mahanali, when can one start going for fertility test? I've already answered that question. It's the same question COO asked. How reliable are home fertility tests in terms of percentage? So here's the deal. Reliability is very important. Getting accuracy is very important. Now, in America and other developed countries, there are some fertility kits we can give you, and we can guide you appropriately on how to use them. But in developing countries, the only thing we can allow you to run at home is your pregnancy test. Of course, we cannot allow you to run blood tests. So we can't allow you to go and do your hormonal checks at home. We can't allow you to do your pap smear, to do your HSG at home. So the only test you can run at home, it's your urine test for checking for pregnancy. Besides that, all other tests, as of today, in developing countries, you have to go to a reliable lab to get them correct, because there is something we call false positive and false negative. If you didn't have what they told you have, it will change your mind psychologically. So I want to believe that if we say your hormones are low, they are low. They're actually not normal. If it's high, they are high. Because if you, for example, if your prolactin level is high, we're going to give you some drugs that will bring it to be within normal range. But if you go to the wrong lab, or assuming you were doing it by yourself and it's normal, and we're giving you drugs as if it's high, what's going to happen is going to be low. So we always want to have accuracy. We always want to have reliability in all our tests. So we have to go to very good lab, a reference lab. There are so many labs that are substandard. There are so many women that go to those labs because it's supposedly cheap, but you're not getting good diagnosis. You see, in medical practice, diagnosis is very important, because when we have the right diagnosis, would have saved your time, would have saved the money, would have saved the resources, would have saved you a lot of heartache. So it's important we have appropriate diagnosis. Okay? Now, like I mentioned, anti-mullerian hormone test is a test we run with blood. All blood fertility tests, it's recommended you do them in the lab. You cannot get accuracy if you do them at home. Now, like I mentioned, in developed countries, there are some test kits, and they can tell you to run some things. Like, if you have diabetes, they can give you glucometer to use your blood to check your blood sugar level, okay? But we want to be very sure of what we are doing, because fertility is very, very delicate. So as of now, we don't have such facility and those stuff that you can use at home to run your test. Of course, if you have AMH of 0.01, it's very, very low. So possibility that you no longer have X is very high. Your anti-mullerian hormone is very predictive regarding your ability to become pregnant. If you have the number you mentioned, it pretty much means you no longer have X. You are practically in menopause. So that's why we have to get that particular report, and the report will guide us on what we need to do. There is no correlation between your vitamin D and anti-mullerian hormone. You can only get what you have. As a woman, as you're aging, your eggs are going to be reducing. Your anti-mullerian hormone is only checking the likely quantity of the eggs you have. So there is nothing that will affect it, just like you mentioned. The vitamin D doesn't affect it. Correct. COO is asking about the type of doctor that should send couples for fertility test. Now, it depends. In a place where we share responsibility, your family physician can send you for baseline fertility investigation. Your general gynecologist can send you for baseline fertility investigations. But guess what? The best person that will address your fertility issues is a fertility specialist. So there's a difference between a baseline general gynecologist and a fertility specialist. A fertility specialist, it's a gynecologist that trained only in the aspect of helping couples that have fertility problems. So he's the best doctor to address your case. If you go to your family physician and your family physician suspects that you might be having infertility, the onus is on your family physician to refer you to at least a gynecologist. When you get to a gynecologist, if that gynecologist is a general gynecologist, the onus is on that general gynecologist to refer you to a fertility specialist. Let me give you an example. In America, you don't just go and meet a specialist. No. You go through your primary care physician, your PCP, if you have any complaint. Unless it's an emergency, you go to the ER. But when you get to your primary care physician, who is also the family physician, they will do their baseline. They will see what they can do. They can run some investigations. When they have their working diagnosis, they will refer you to a subspecialty. So if your problem is gynecologically related, they will refer you to a gynecologist. If your problem is ENT related, they will refer you to an ENT surgeon. If your problem is neurosurgery, they will refer you to neurosurgery. If it's a kidneys problem, they will refer you to a pediatrician. So it's important we understand that in the field of medicine, there are many divisions. So the best person to help your infertility problem is a fertility specialist. Don't be afraid or shy to ask your doctor, Doc, are you a fertility specialist? Politely, if he's a good doctor, he's going to tell you exactly what he can do. The problem is, most doctors, depending, there are some good doctors. Some doctors, let me use the right word, some doctors will not transition you to a place You will get the care you need. They will be micromanaging you. They will be trying a lot of things. They will be pumping your body with Clomid and all that. At the end of the day, when it's late, you begin to go to the place you're supposed to go to in the first place. So be wise to ask questions. If you're not comfortable, like, let me give you an example. If you've been with a particular doctor and is giving you Clomid for 5 years, come on, Clomid is not your problem. You need to transition. Okay? All right. Hormonal imbalance. Chinyere, your question is not complete. Please rephrase your question, and we should be getting ready to end the clinic. You mentioned something about hormonal imbalance and a woman being born with hormonal imbalance. There are certain things that might be familiar. There are certain, genetic predisposition to some problems in hormones that you can be born with. So you might have some missing protein, missing stuff here and there that will predispose you to have deficiency in particular hormones. So yes, there are some women that will come into this world with some inborn error in the way the body functions. So the answer is yes. I want to believe that's what you're trying to communicate with me. Okay. Do we have any other question? Okay, so I want to believe that's the end. Now, please join me to our Facebook page. I'm going to repeat this same clinic, and we have more audience there. We are going to give you today as the deadline to register for the event tomorrow. So at the end of today, tomorrow we're going to just be getting ready, putting our notes together. So if you're interested, please make sure you register today. Registration ends today. Admin is in the clinic. Admin will help you if you have a need to register. And please, once you are done registering, follow the instructions. Send email appropriately. When we send you email, there's a link for you to join through the Zoom link. That's a dedicated link for you to join. If you don't follow the right instructions, you will miss the event. Okay? All right. Thank you so much. I'll see you guys in Facebook, and enjoy your evening. Bye-bye for now.